started joining in also. So it's 2:59. In a minute, we'll just get started. So friends, those of you are joining on Zoom or those of you are watching live, in case if you have any questions, you can ask in the comments on social media or chat in the Zoom. We'll take some of the questions. Joining in also. Yeah. So it's 2:59. In a minute, we'll just get started. Okay, I'm just getting. Okay, so another thing we want to do is to encourage people to ask questions during the sessions. So what we do, typically when we do in-person meetups, we have speakers announce some sort of rewards. Online it becomes a little awkward to manage. So what we do, we'll select 2 people who has asked good questions and they will get a Zomato ice cream from my side. You text me your address and I'll send a ice cream through Zomato, but ask good questions. So idea is to encourage people to ask questions. So you can use social media chat, comments section or Zoom chat to ask any questions. With this, thank you so much, everyone. It's 3 p.m. Idea is to start on time. So we have organized this program in association like eChai and the IIPHG Technology Business Incubator together have organized this program. We have Dr. Patel from the Technology Business Incubator. So Dr. Patel, if you can tell us a little more about the institute, about the incubator, and then we'll get started with our session. Yes, Dr. Patel.
Yeah, so good evening all. So briefly, I can say that the Indian Institute of Public Health is a first of its kind university aiming to strengthen the overall healthcare system with through various education, awareness, various initiatives and research as well as advocacy. That's where the Indian Institute of Public Health stands for. And of course, in the Indian Institute of Public Health Techno Business Incubator, there's also a first of kind Techno Business Incubator focusing on public health. And that's why I'm very pleased to see all of you on the same platform, and also pleasure to be a part of this entire event, which will really help not only the incubatees but aspirant entrepreneur to ensure that whatever they are aiming in public health would be possible through this kind of initiative. So thank you, Jatin and entire team for organizing this along with the IIPHG TBI. Over to you.
Thank you so much, sir. If this was an offline event, I would have asked everybody to clap. That I will do it online. So the format is that we'll have each of this panelists briefly introduce about their background and about their work, so that you get context about a lot of answers that they will be giving. We had asked our participants or people in the audience to ask some questions. We have some summary of questions that people would want to ask, but at the same time, we want to encourage people to ask questions. So towards the second, I'm say around 3:30, we will bring 1 or 2 people from the audience on stage to ask questions. So ask questions, I'll bring some of you, and 2 people will go away with the ice cream from Zomato that we will sponsor. So ask good question. That is more important because the entire program is built for that. So with this, we'll just get started with our panel. Kumar, if you can tell us a little bit about your background and about your firm.
Thanks, Jatin. Thank you, Dr. Patel, for that insight about what you all are doing. I'm very passionate about public health, and preventive healthcare is something that I've been working on for the last few years. Hello, everyone. I'm Kumar Shankaran. I'm the CEO of Lucid Bio. My startup works on the microbiome space. So we're a deep science, deep tech startup working on looking into a person's microbiome and giving meaningful reports on that. I have done my master's in biotechnology, and for the longest period, for about 10 years, I was working as a systems biologist in various companies. So I've been analyzing biological data for the longest time. Then in 2014, me and a couple of my colleagues got together. Basically, we were not getting jobs in India. We had to go outside India for jobs. So we said, might as well start a company and create jobs in this field. And that's how we started our journey. Like I mentioned, I'm very passionate about preventive healthcare. We look to, we want to provide healthcare and not sick care. So catch something very early, see if we can prevent it, and see if we can prevent it with nutrition and all kinds of ice creams that Jatin is providing. So that's that was the scope in which we started, and we thought the microbiome was probably the best way to do it. So we've been building our science, technology, and product ever since 2014. Yeah.
Thank you so much, Kumar. Romita, your brief introduction, your background.
So I'm a biotechnologist as well, like Kumar, but I went on to do management because I wanted to see the changes in the patient's life quicker by building products for the masses and to reduce the cost of treatment. I had a personal reason to do that because I suffered from cancer, and I've seen that how many people cannot afford treatment, and also they have to people from the tier 2 and 3, they have to flock to the city. So I wanted to address that as a child. So yeah, I worked for Biocon in the nephrology department, and then I headed the medical devices department in various Indian as well as foreign companies. And then I learned how to import, how to launch medical devices in India in order to give people a choice of prices, choice of brands. And with my startups, so I'm running 2 medical devices startups, which are my third and fourth. Obviously, my first and second failed. So with those products, we had been working into the supply chain of medical devices. So this was back before pandemic, and due to pandemic, we got the spotlight that we had been waiting for so far. People aren't generally now aware. They understand the quality of mass pulse oximeters. These were not the names people knew about. Having home a device or something to monitor yourself, again, preventive, why it is so important, we understand that. So yeah, so right now we are into distribution and supply of medical devices. We have been playing a very crucial role in these last tide as well as this pandemic, and we are now prepared for the next tide to make our villages more sufficient in terms of patient monitoring devices, so on and so forth.
Thank you so much, Romita. Pooja?
Hello, everyone. I'm quite flattered to be a part of this learned and much experienced group because I am just a techie, okay? So I was working in US, and a personal, somebody in the family got suffered from cancer, and we came back to India to be with them. And then we realized a very basic issue, that medical records generated by the clinics and the hospitals are distributed across various systems, and it's almost impossible for the providers to get a complete view in the patient's treatment details and the health history, and which kinds of makes it difficult for them to provide efficient treatment. So since last 10 years, we've been trying to address this problem by creating, so we've got an array of solutions. So as India's way of working and the kind of systems and kind of infrastructure we have is so different. We have different solutions for different areas. We have IPD digitization solution, we have digital prescription solution, we have chronic management solution. But our vision is to empower the providers to get access to the digital history of the patient on a click and provide efficient treatment and be able to connect with their patients even remotely once the patient is out of their premises.
Thank you so much, Romita. Sujay?
So I am Sujay Santa, founder CEO at iCure. iCure is a population health management company. And before starting, I worked in IBM and Oracle, last in Oracle as a solution architect. So around 12 years I have spent in the tech space. And we understood that technology has been, mostly in case of healthcare has been built around the businesses, meaning that when a patient walks into a hospital, all the patient registration billing happens. And when the patient is walking out of the hospital, the patient loses all contact with the doctors. So I can definitely resonate the thought process which we had 10 years back, wherein we were all talking about that how broken is our public healthcare ecosystem. Unfortunately, we are seeing the reality today. So in a nutshell, we are able to provide affordable and accessible primary healthcare using technology. So we are serving close to 12 million population, treated 1.3 million underserved patients, and serving across 9 countries in Africa, MENA, as well as we have started in Vietnam as well. Yeah.
Thank you so much, Sujay. Saurabh.
Yeah.
Got to unmute. Hi, thanks, Jitin, for setting this up. Dr. Patel for building initiatives around public health, facilitating these kind of things at public health. I think it's a great time to build for healthcare. I'm Saurabh. I'm co-founder of a company called Plum, and we are doing health insurance platform for corporates and opening up an access to healthcare as well. A quick background on me: I come from academic research. I was doing my master's and then doctoral research at Hasso-Plattner in Germany. Moved out of the doctoral process in between, looking out to do more action. So Plum is my second company. The first one, I had built a customer support optimization tool, which got acquired by Freshworks. And with Plum, it's a decade-long project for us of increasing the penetration of health insurance in India and opening up the access to healthcare. We are on a mission to get 10 million lives covered in the next 3 years.
Brilliant. Thank you so much, Saurabh. And friends, in case if you want to ask question, you can ask in the chat. Around 3:30, we'll bring some of you on stage to ask questions. And there are a lot of questions I would want to ask about your journey or challenges, but one, addressing the elephant in the room. COVID happened. So before COVID, what was your work? What changed because of COVID? And now after 1.5 years, what is the way forward for you? In that context, if you can share about it. Kumar.
Actually, the COVID didn't change too much. I mean, we were the kind of space that we were in preventive healthcare. There was a lot of education that needed to be done, before COVID. The one thing that probably COVID changed a bit is I think there were a lot of consumers who opted for preventive healthcare after the pandemic hit. From a startup point of view, what really changed for us is the supply chain. I mean, we only then did we understand the entire logistics of reagents coming into India. Who the suppliers are, what's the processes of all of these coming into India, expiry dates and so on and so forth. So all of this was never looked into. It was some trivial thing that the logistic department was looking into, but that's something that we had to focus a lot on and solve during the pandemic. So the space of preventive healthcare really opened up, and we have a lot of inward queries coming in right now, asking about what our product is and what it can do for a person's health, which was never the case before. So these are two things that I can point out that COVID has changed.
Thank you so much, Romita.
Yeah, so two things primarily. One, the supply chain is we were dependent on external parties for the supply and distribution of our products all over India. But in COVID, even the unicorn companies failed to do justice, and the timeline has suddenly shifted from 7 days being okay with a customer. Now it is 2 to 3 days, and then you're dependent on third party. So that hampers the whole thing. So we understood that we have to take charge of the supply chain going ahead. So that is the one biggest massive change, to do our supply chain. And which part of India would we be doing ourselves, and what part to outsource. And we have found that even the smaller vendors are way better than larger companies in terms of if we want to rely on them and build on them. So that is primary. The secondary is pre-COVID, it was B2B and B2C. But post-COVID, we understand that now people have started buying products themselves, and eventually home healthcare would see a major shift. So B2C is something we have started focusing on, and retail is also a part of it that we are getting into.
Okay. Thank you so much, Romita. Pooja?
Yeah, so COVID was a big game changer for us as well. We've been, so our forte has always been to be able to provide digital prescriptions, but our aim was always to make the patient benefit out of that by with the means of getting access to the patient health record. And teleconsultation has been on our list since long, but we were not getting acceptance from the doctors fraternity for that. With the first wave of COVID, India had this big change in mindset of people, where people started accepting teleconsultation as a valid mean, and the government also, which had been sitting on the norms and the regulatory compliances rules for teleconsultation. They defined in a month itself, and we saw a big surge in the teleconsultation. But another thing that happened, everything else took a backseat, especially people suffering from chronic diseases like asthma, diabetes, BP, cardio issues. Those people could not get access to their hospitals. And that made us think how we can actually enable health for them. And that is how we started working on the chronic care management part of our application, wherein using the same pieces that we had developed earlier, we extended them and we allowed doctors to create plans using which they can monitor their patients sitting wherever they are. There's no need to come to the hospital. And an intervention can be made by the means of automatic alerts that happen when the patient's parameters are beyond the boundaries. So that is the new shift that we're looking at post-COVID now.
Yeah. Thank you so much, Pooja. Sujay, last time you mentioned about managing biobubble. Now that cricket has, I don't know whether it has started at 3 p.m. or not, but if you can share what has happened in COVID and what are the exciting things that you are up to.
Yeah, I think the couple of things which is certainly happening, and in terms of the challenges, I'll just put a small data. As on date, more than 9 cities in terms of the inoculation drive, 9 cities population has got more inoculated than 115 backward districts in India. So that's a huge skew that is happening. So how do we resolve that? And with every passing day, I think that gap is becoming bigger and bigger. There are a lot of challenges, definitely, as Romita was talking about the supply chain. That is definitely one of the issue. Cold chain is another issue. We all talk about and feel good when we read the headlines that by July, the productions would be, 3 times, 4 times with the vaccines. We are getting more and more vaccines in India. But there are other challenges in terms of the number of vaccinators in India. We simply don't have enough vaccinators. We have a deficit of at least 1 million vaccinator shortage if we really want to do all of that in the next 6 months. 6 months is definitely impossible. In the next, even at 9 months, that is another challenge. That how do we solve that? The third challenge is, which we all see, is the vaccination hesitancy. Again, we have seen that we all talk about that there is problems of doctors not available. We have seen examples wherein even if the doctor is writing iron and folic acid, that the mother won't take that, thinking that the baby would be dark in color. And in case of vaccine hesitancy, I'm sorry to say that people feel that it's a government's propaganda or something, so they simply don't want to take that. And we all know that if we, as a population, as a nation, if we all don't get vaccinated, it's a big challenge for all of us. As on date, the virus is continuously getting mutated. If not in India, somewhere in the world, it's getting mutated. So there is always a threat. So if you think that just by taking 1 dose, I'm seeing news from various business houses, all our staff has been vaccinated. What does it mean? And that you have just taken 1 shot. I mean, there's the second jab and still the efficacy is not 100%. So it's good to say that, but it's wrong to say that just getting 1 shot, you are absolutely safe. So these are all the challenges. So we have started the vaccination drive in partnership with government, in partnership with various factories, industries, and we have also started working on the behavioral change, which is very, very required on the ground. Meaning that working with the villagers, working with the communities, working with the ASHAs and the ANMs, that it's good to be vaccinated. It's definitely good to be vaccinated because, Dr. Patel would also agree that this behavioral change or these kind of things would be very, very important for us to ensure that we get the inoculation as much as possible in the entire country. That is one of the biggest challenges for us right now. The other important things, for example, as the factories and the industries are opening up, we have started a stream of creating more of a series of tests. Again, it's a combination of the olfactory. We have the olfactory test, which is for the mild olfactory dysfunction. That's the loss of smell. So, and on you integrate that with pulse oximeters as well as the RT-PCR when and where it is required. So then you are able to give a more comprehensive sense of security to the team. And the biggest challenge for us is, we have not started the vaccination for our children. And there are talks, the scientists are of the opinion that the virus might mutate again, that might be a threat to the children. We don't have any clear answers. We all wake up every day with some unknowns. So nobody can say that tomorrow we have a very clear picture, very clear roadmap. This is it. We are all living in unknowns, and we really don't know that what is the next threat that is going in front of us. So I would say that we need to strongly encourage that. Just because unlockdown has started opening and we feel that, okay, now we can all go out, and after the first wave, we all felt that second wave would be milder, and we have all been proven wrong. And now again, if we think that the third wave would be milder than the second wave, let's not do that mistake once again. So I think that's very, very important.
Thank you so much, Sujay. Saurabh?
Sure. So we started Plum, the journey began in 2019, November. And the premise of the problem was that, look, we are a very underpenetrated country. Though we are about to hit in the top 5 of the GDP as the highest grossing economy, but our healthcare expenditures are less than 1% of that GDP. Our insurance penetration is less than 4% of that GDP. So it's a massively underpenetrated country, and it is inevitable that we would move towards this building the safety net for India, be it the state-sponsored schemes like Ayushman Bharat or corporates rallying in formal and informal sectors and increasing those. And our targets were that it could take us 10 to 15 to 20 years to build a deeper penetration in India. COVID has definitely changed the game, where now we think it could be just 3 to 5 years away, where we would be sitting at a significant penetration of this safety net. If I sort of summarize, there are 2 trends which are happening on this. Is one, massive increasing awareness of people that they need this safety cover. A lot of people from middle class had been pushed to poverty because of these extraordinary expenses that they have incurred. So huge awareness. The industry has become otherwise what used to be a push industry to now a pull industry, where people want insurance, especially for their employees as corporates. And the second is the digitization of these very old insurance companies itself, who were reluctant to technology intermediation and change. One of the examples of that digitization is claims. Now people can't go outside their homes. So what they are doing is that they have allowed companies like Plum to now take pictures of the pharmacy bills or diagnostic summaries and educate claims completely digitally. We hope we will be able to retain this behavior with our insurance partners. And they've seen the optimization because of the digital journey.
Yeah. Thank you so much, Saurabh. And we are a lot of early stage startup founders or public health professionals or people who just started their health tech ventures. So I asked you questions about your present. Now I'll ask you a question about your past. So when you started, so typically now that there is a lot of news, every day the news comes, there's some startup raised millions of dollars. So when you started, how did you navigate your first 1 or 2 months? You briefly mentioned that, why you started, but what did you do in the first 2-3 months? What kind of breakthroughs you got, what kind of support you got? If you can share any specific anecdote, that would be great. Kumar.
Sure. We were building our technology for the first year, so there was a lot of focus on building the technology internally, and then proving it by doing few services and saying, we had to go past the doubt of whether what we had built was actually world standard or not, and we were in a very, very niche and new field. So that is what we were doing in the first year. So it wasn't about customers, it wasn't about market, it was whether the tech will actually work or not. And then I remember when we did our first service project, I think the amount that we got paid for it was about 2,500 rupees. But that gave us more thrill than anything else that we've done till now, because it actually proved that our technology works.
Yep. Thank you so much, Kumar. Romita, so any particular support you got, that you struggled and then you did something that really worked well? What was that? Any specific anecdote if you can share?
Yeah, so I went back to my clients. We used to do consultancy while I was still working. So I had a list of people I could go to, because when you just start up, the first thing that you struggle with is to build trust, right? So you need to go to people who already know what do you deliver and they can trust. So I went on, so I had to do consultancy projects, which would be launching their products in India. And for MedSaman, what we did was to start to distribute those products in India. So first we provided service, and then we started investing capital, buying those products and selling. So just simple, testing the market is what we have done. The second thing we did was to pilot. So we chose Shimla and Mandi. We were supported by IIT Mandi back then. So we did our pilot there, and we thought that, okay, if we could successfully run our pilot in a difficult terrain as this, we can do that anywhere in India. So yeah, it was a success, but it took time. Yeah.
Thank you so much, Romita. Pooja?
Our first year was very interesting because we started pre-WhatsApp 10 years ago, and it was mostly a US return couple backed startup. So a lot of doctors, they were listening to the concept for the very first time. So prior to starting, we had already done the market research on the need. But what we did not realize was, till the time we were talking about the need, they were all very happy. The moment we started talking about price, everybody was like, how can we pay for such thing? We have so many people to do this. And because there was no compliance requirement as such. So we did quite a few experiments. We to start off with, we came up with slogans like, okay, you can scan your patient record in a price of an eclairs, something like that. So the price is almost out of the picture. We wanted people to try on, and I think that really worked. First, we were able to establish the trust with the hospital fraternity in Baroda. And we realized that the doctors, like, you will not go to a doctor just because you saw him online. You will first try talking to your friends, your family, and only you will go to the trusted people. Same as with the doctors. Before, they have burned their hands with IT vendors so much that before taking on any other new IT solution, they want to take references. So we did few things. We took price out of the picture. We said, instead of spending on marketing, why not spend on building trust? So we just took off all the conditions. You want to give us one record, one paper. You want to ask all your records back. You want us to do it in one day. We'll do it all. So we did all sort of experiments. The first 6 months were like really a fun ride for us. But yes, we are reaping the benefits of that trust that we established until now.
Okay, thank you so much. Sujay, any specific from your early days?
Early days, yeah, I think a lot of, in terms of the challenges, if you want to know, of course, there has been a lot of challenges and learnings in the early days. So for example, when we were talking about our solution and we were trying to meet the government officials, of course, we were not so much encouraged. So that has been a challenge. And from there now, for example, because of our work, we get to meet the principal secretaries, get their times and slots. So those things, I think that's been a journey altogether. In terms of other things, for example, technology, and somehow the doctors don't, go so much, and that's been a major challenge for all of us to push technology for the doctors. So that has been, but thankfully, after the pandemic, we are seeing that there's a big change in terms of the adoptions on the ground. The other important things which we are also seeing is, for example, in the middle of the pandemic, when we rolled out our technology for the entire state of Nagaland, and now in the second wave, we have rolled out the telehealth for the in Jharkhand. For example, in Jharkhand, the PHCs were all locked up for roughly around 2 years, and so we went there, we opened the case, we broomed and cleaned the place, and in the last 2 weeks we have seen close to 1,200 plus patients just in these two primary healthcare centers. So yes, I think challenges are all across. You have to just stay on the ground and continuously. It may not be that you will get no's many times till you are able to move from no to an yes, but that persistence is definitely the key to make it happen.
Awesome. Saurabh, early days for you, but you have phenomenal growth. So things about, and there was a question about competition. So you have a strong competition. So any specific anecdote from your early days, and how do you navigate competition?
Sure. So look, before even incorporating and writing our first line of code also, we are technologists. Me and my co-founder both are technologists. We have done tech companies before. But this time we did not start writing the product or the code at all. We, for the first 6 months, just did stakeholder analysis. There are multiple stakeholders in the business of insurance. We would have at least talked to 100 corporates of different sizes, 10 people to 10,000 people, sitting with their HRs and understanding what is the problem when they go and procure health insurance for their teams. We interviewed another 50 or odd employees, understanding, do they even know what health insurance benefits do they have and how they go and navigate and use it. We took flights to Mumbai, met dozens of insurers, understanding what is their problem in distribution. So after the 6 months of initial stakeholder phase, what we were looking at is a very sharp, focused go-to-market. And that revealed to us that the market of SMEs had largely remained underserved. So when we divide corporates, when you look at the corporates could be 10 people all the way to 100,000 people of Infosys and TCS. So we had segmented these markets into different segment types, and we had about 10 segments to begin with. But we only chose 1 or 2 segments to keep our focus and launch the product as Plum. And we continue to remain focused in these 2 segments today, as despite of the growth that we have has happened in this segment of SMEs and startups, which had largely remained underserved. And they had their most important demand was give us affordable health insurance, and second, remove the friction from this purchase process of health insurance. And that's what I would advise is that figure out your sharper go-to-market. If I could talk about competition, yes, Jatin, look, there are 450 brokers out there in India, and about 10 times more corporate agents who would do intermediation with corporates and get them health insurance. There are insurance companies who directly also go, and some of these are digital insurance companies. Some of them are decade-old, 2-decade-old insurance companies. Where we differentiate ourselves is basically understanding the complexity and really simplifying this process and playing on the affordability, the accessibility, and usability of insurance. So building experience on those. And so far on this underserved market, we have been able to grow really fast.
Thank you so much, Saurabh. We'll take some audience questions, and there are sort of questions that had. So I'll ask some specific questions to each of the speakers. But anybody else would want to ask question? Gayatri had raised the hand. So those of you who would want to ask a question, raise your hand. I'll bring you on stage. Reena has a long list of questions that she wants me to ask you, so which I will ask. So if none of you ask questions, I'll give the ice cream to the incubator team, to Reena and Dhruv. But please ask question. I'll give ice cream to them anyways also. So, and there was a question about regularity. So in healthcare is a very moderated industry. Any challenges you face? How do you navigate? Kumar, you have regulatory hurdles?
We actually have the other problem. There's not too much of regulation in what we're doing. Even the FDA has not come up with guidelines as yet. So we are actually coming up with a framework to say, this is what that needs to go into the regulation, at least for the Indian market. And we've been actively working with CDSO to try and to get this changed. So I wish there was regulation. It would have been easier for me to go down that path than to actually make the regulation. But that's the game of the beast that we were facing.
Awesome. And all of you mentioned that you build this because there was a problem that you identify, you wanted to solve that. Now that people are talking about taking it as a career option, because there are a lot of public health professionals. So what would you advise them, Sujay, that how the people can make career out of this?
A career out of what, if you could say, Jatin?
Becoming a HealthTech founders or taking up opportunities in a growing HealthTech companies. Like when all of you have scaled up, so you would need professionals who have a HealthTech background or health background. So what would your recommendation to that kind of folks?
Yeah, I would say definitely from the outside purview, you would say that health tech might look little complicated. I mean, it's much easier to do an e-commerce or an aggregator business, but health tech has a lot of elements within that. So it has different stakeholders like doctors, patients, paramedics. It has different devices. It has now the new NDHM is coming into the play, National Digital Health Mission. The patient data privacy is with the JPC Joint Parliamentary Committee, so that will become a law. With that, we'll see more regulations, the way data is captured, stored, processed, transmitted. And a lot of AI people are thinking, when they are thinking that, okay, they would like to build on artificial intelligence within the health space. One of the major challenges they are seeing is having a very myopic vision, meaning that they feel that the data is only for 10% of the top 10% of the population, which resides in tier 1 in the cities. But if you have to really create a digital health infrastructure, you have to look at different permutations, combinations at a patient and a health worker and a doctor, at a village level, district level, block level, all of that. So those things are, there is a lot of options that are definitely there. The other important things which is also coming up, again, I would like to tell is there are some talks wherein they want that we have seen oxygen concentrators, for example, being flooded from all across the globe, but we really don't know that, let's say, when we have an oxygen concentrator coming in from Germany or France or USA or China, probably we don't have enough people to operate those machines. So that has been also one of the major challenges, especially when you say, okay, we become gung-ho that, okay, we have got 50 boxes of the oxygen concentrators and now we are delivering it there. What we have seen on the ground is that people simply don't know that how do they think. I mean, so how many of us have learned or heard the word about oxygen concentrator before the second wave? So hardly, or maybe before the pandemic, hardly, very few people. So, and then you expect these people to operate these things. It's not only about operating, it's also about giving the right quantities to the patients. So all these have been a major challenge. So now there are a lot of skill building opportunities which we see, wherein there are needs for skills, right? Vaccinators, emergency technical assistants, GDAs on these levels. So there are a lot of opportunities within that space also, because as a country, if we really want to strengthen the whole public healthcare, population health management, we have to strengthen on these factors as well. Technology is definitely good, but with technology, what the example which I want to tell you, technology and capacity building has to go hand in hand. If I have got a rocket science technology, but I don't have enough people to use that, then what is the use? It does not go anywhere. So that's what I wanted to show.
Yeah, thank you so much, Sujay. Gayatri, Arpan, I'm enable you to speak up, and Rina, if they don't speak up, you speak up. Any question that you may want to ask to our panelists? Gayatri? Or Arpan or Rina? Rina, you had a long list of questions. So if you can speak up any question that you would want to ask on behalf of your students. Rina, you can speak up. Or Gayatri or Arpan. Else I'll just run through with the set of questions that I have. Okay, I'll just run through with next set of questions that I wanted to ask. So when you, so one of the theme was to scaling up. So you start with challenges, you get some product market fit, and then you would want to scale up. So you started alone, you had partners, or if you had co-founders, how do you manage the relationships that, so that you remain co-founders even after you have success or failure? Kumar.
With respect to co-founders, I mean,
Yes.
the one thing that we did was we didn't meet outside office hours. That I think that is the key for our long relationship right now. So no matter how tempting it was to go out for a beer afterwards, we very seldom did that. I mean, we all three of us have good rapport. We respect each other, each other's opinion. We're very blunt and honest about what we do. But there's also some away time from the co-founders. I think that worked well for us.
Awesome. Pooja's story is probably totally opposite of that. Pooja.
Exactly. That I wish I could have done what Kumar has done. My co-founder happens to be my husband, so and it's so difficult to switch from a CTO to a wife, and I started when my kid was just 2 years old. So yeah, so we have to take hard breaks at times. What we consciously do, we both are techies, but we consciously decided, okay, one person remains in the business, one person only decides the tech portion. So I don't interfere in his things. I contribute my ideas, I participate in strategies, but decision maker when it comes to business is him, and when it comes to my technical designs, it's me. We don't try to cross each other's boundaries. That has worked well with us till now. And even when we have hired people as a part of our core team, we have given them the similar amount of responsibilities, and we have treated them like that, even my employees. So that's the beauty of working in a startup, that you actually experience the life of an entrepreneur without actually risking your money and your career. So I would encourage everybody to at least work in a startup before you actually jump into entrepreneurship. That gives you a very good insight into the life that are going to lead for at least 3 to 5 years.
Correct. Thank you so much. Romita, you're co-founder or early employees.
Yeah, so I've known my co-founders like more than 10 years. So we already know these strengths and weaknesses. So that's how it had been. I mean, they were my co-founder in my second startup. And so when we start the third, we pull, right? Because, so meanwhile, what happens is the noise or the people who do not align to your goal or vision, they would, get off, because it's a very long haul we are in for. So yeah, so knowing somebody for very long really helps, at least for us, because it's going to be for very long time, and we are into a legacy business. I mean, we would want to be a legacy business. So yeah.
Awesome. Thank you so much. And those of you who would want to ask, you can ask your questions in the chat. I'll just read it out. Sujay, you have co-founders or early partner employees. How do you make things work?
Yeah, so I had, I would say 2 persons who had joined with me in the early days. But, that time we were just a pure technology company, and then we moved to healthcare delivery. So, we parted ways. So I've been since then more of a solo founder.
Okay. Yeah. Saurabh?
Sure, Jatin. Look, I met my co-founder 6 months before starting up together, and we were introduced by a common friend. And we went on this dating process, not just between ourselves, but with the market and idea as well. So I think we had this prolonged dating period. But what we are bringing here is, I think, look, both of us had done previous companies and built companies, organizations, worked for organizations. I think it's a emotional maturity is what we understand between each other, and also keeping the mission and the company first, and us as second. I think these are the two sort of relationship between these two pieces. We haven't had any problem, and I don't foresee any problem as well, as far as we maintain these two tandem of these two things.
Okay, awesome. And we have a lot of early stage startup founders who are there. What would be your advice to yourself who's starting up again? What would be your advice to your younger self? Now that you have those considerable experience of building a business, what would you advise your younger self? Kumar.
Try something simpler next time. But I mean, the one thing, I mean, like Pooja mentioned, I think having experience working in a startup always helps. Second time, and similarly, I think second time entrepreneurs do much better than first time entrepreneurs. I mean, that's what a few of the studies have shown. Basically, the experience I think you get is the kind of perseverance that you need to put in to be okay with the ups and downs. I mean, there's going to be more downs than ups, and to be okay with it and to keep taking decisions, not knowing all the facts and going with your gut on a lot of these things. So just give myself a little more confidence the next time. Say, it'll happen. Just carry on.
Okay, awesome. There was a question by Arpan. Arpan, if you can speak up, else I'll just read it out. And
Sure.
yes.
So, hello, panelist. Thank you for sharing all this and anecdotes. I have a question that we are still struggling. Struggling that one is a B2C aspect where we can go directly to consumers, but with our startup we have an opportunity to go with business to government. Like governments can be our customers, and another is a social impact. Organizations can be. So, is any one of you had explored this route? Uh, that's my question.
Sujay, probably you can take this up.
In terms of, sorry, can you come again, please?
So it was about working with the government, so their potential customers is government or social impact organization. So in your experience, have you had that experience, or what would you advise? I believe that is the question, Arpan.
Yeah, so we are actually working with the government. For example, we have provided our telehealth for the entire state of Nagaland. We have also been partnering with in Jharkhand across sub-centers. So just if you are dealing with health, so as health is a state matter subject, you have to approach the government and you have to have good relations with them. And if you are able to, I would say there are different ways of moving in that. In our case, the billing does not happen from the government; it comes from development organizations. And in some cases, of course, we have directly work with the government. Let's say the KMC Kolkata Municipal Corporation to provide that. And relation or trying to partner with the government is not a 24-hour thing. It will take a lot of time, a lot of patience, so to say. You have to really look at that, what they really like, whether so for example, I just give one example. When we started our mother and child care intervention as a research project in one of the districts in Karnataka, suddenly the ASHAs and ANMs, which are the government ASHAs and ANMs, because we have deputed, community health workers on the ground, our own community health workers, so they were carrying smartphone loaded with their application. And suddenly these ASHAs and ANMs, they got threatened that, okay, are their jobs, the livelihoods at stake? So they were trying to create those resistance. Then we met the BMOH, Block Medical Officer of Health, and the CMOH, the Chief Medical, who sits in the district. And we said that our common mission is to reduce maternal deaths, infant deaths. That is the whole objective. So we are not there to compete with the government at all. And then with a lot of such things, they got convinced. And then the ASHAs and ANMs were supporting. So it's the way how you are looking at it, how you are positioning it also matters a lot. Because if you are trying to say that you have brought in innovation, so you are superior to the government or their stakeholders, then of course you will get resistance. But if you position yourself that you are kind of trying to support them and not criticizing in every way, then definitely you will be able to get that support. So that is very, very required in terms of the fundamentals.
Awesome.
Thank you, Sujay.
Thank you so much, Arpan. You win the Zomato ice cream. Gayatri, you want to ask? I'll just run through with my rapid fire question that I wanted to ask everyone. Or Rina, you want to speak up? You can speak up. Rina.
I would just like to understand the funding opportunity they are getting as a health tech startup from government or from investors. How much it is difficult or easier?
Yes. Rina, with the echo that your sound, it sounded like a divine intervention. That's a very important question. That you raise funds or what would you? So, sort of, there are a lot of news about plum raising funds. So, how's your experience, and what would you advise other startup founders?
Yeah, I think my advice would be to be conscious of what market you're attacking and whether you as a startup are creating a new market opportunity here, or are you playing on an existing market opportunity where there is clear path to revenue too. Basically, when you're looking at investors and VCs, they are trying to see how quick or what is the revenue opportunity or business building opportunity. So some of the tier one VCs would do a quick back of the calculation and try to figure out, can you do 100 million revenue in some time? So identify whether you are creating a new market. If you're creating a new market, the chances are that VCs don't have the thesis yet. So then you have to go for the investors who are building the thesis for that kind of market, because otherwise they will not invest in you if they don't have a thesis. But if you're disrupting an existing market and you have a clear, and if you could show a clear path to revenue, then visualize this for your investment pitches. That will help your investors to figure out how would you crack that market and what is the revenue opportunity. So this is an exercise which you should definitely have, whether you're creating a new market or you're going and disrupting an existing market.
Pooja, you had raised funding also. So in your experience, what are the opportunities for health tech startups and any government grants that any one of you have got? Pooja.
Yeah, so we were incubated at iCreate as well. So I think the government grants, especially like NIDHI things are there, then incubation centers are there, and government is doing with NDHM, they want people to come and make this more successful. And I think if the idea is like really good, you will be able to get few grants as well. Regarding investment, I think B2C, how I see it, that in B2C, if you go, there are higher chances of you getting an investment rather than B2B, because B2B, first of all, services, the margins are less. And if the investment is a double-edged sword, you become answerable to somebody else, plus you're playing with somebody else's money. So obviously, you'll have to give the returns. So till the time, so we were bootstrapped for first 5 years. And I think that those were simpler times for us. And yes, funding has helped us. Certainly it has helped us. It has helped us scale from 1 city to 16 cities in India. So it has certainly helped us, but then you are more responsible, right? You cannot take so many, you cannot experiment a lot. You have to, whatever you promise to your investors, you have to give it back. So be very cautious when you go and raise investments, and just don't look for money, I would say. Investment opportunity, if the business idea is good, you'll certainly be able to raise investment. But look for smart money, people who can actually help you in your business. That's what we did, at least, because then it makes it simpler when you are trying to pivot or you're trying to do something. If they understand, they would be able to support you.
Yep, awesome.
Yeah, so Jatin, can I interrupt?
Please.
Okay. Yeah, Pooja, so very interesting, because when Purple Doc was there, 4 years back or 4.5 years back, I was in Baroda and talking to one of the doctor and asking that what it is all about. So he was just asking, he was sharing that good feedback that not to worry and everything is taken care by in archives and whenever. So after 4 years, maybe I've seen some stories, and I found that you are in EHR and now teleconsultation. So the one question is that, was your journey planned, or in between from archivals and documentation you shift to the teleconsultation and maybe EHR point of view based on the need and demand of that, and how you do that? So from entrepreneur point of view, the incubatees and other point of view, they can understand that overall your journey has really, how it has been changed because of circumstances, or it was planned. And if it is planned, then why you are planned, that gives them a little bit better idea to the audience.
Okay, so it was just not planned like that at all. So when we started, I wanted to actually create a product which can help doctors get access to the data that they need. But at that point of time, they were, as I said, I always use this word pre-WhatsApp era. Doctors did not even have access to internet. They did not have computers. Their staff was not trained. So the need of the hour was Purple Doc's digitization service, which we still are one of the India's leading digitization providers. I think probably we are the only ones which has all the pieces together and has this kind of an offering. Even in last 10 years, nobody has been able to match that to us. It still remains my flagship offering. And from my same customers, we got this requirement that they wanted to do their clinical records as well. Now, IP records, they get dumped into the MRD, so a service can easily serve that. But records like your prescription when you visit a clinic, they are to be given to the patient. And once the patient comes back in the follow-up again, there are chances, and most of the times that happens, that he doesn't carry his prescription. Then how the doctor can actually provide a better treatment? He has to do all his experiment, which medicine he gave, he has to start from zero. So this was the problem that we got from our existing customers. And because we had got their trust and we had got the foot in the door, we thought that we are one of the best people to understand, and we had the strength to create that technology because we understood we had already 130 hospitals when we started with the EMR. So having the trust of 130 doctors and hospitals gives you a lot of leverage, because then you have a way to understand your clients. And our EMR offering is absolutely designed by the requirements given by our own doctors. And that has been acting as an edge. And same thing happened with our teleconsultation, and the same thing happened with our chronic management. All these requirements we've been getting from our customers. And because we are strong enough, we have the technical strength where we can design softwares which are compatible to the Indian healthcare. We are able to leverage that situation.
Awesome. Thank you so much, Pooja. It's 3:55. We will finish at 4. So I want to do a couple of rounds of those rapid fire. But before that, Sujay, you have a considerable amount of scale and customers. So do you work with other health tech startups, or like, is there a direction that you are taking now that, there are newer health tech startups are coming up, they might get benefited from your ecosystem?
Yeah, absolutely. We actually believe in a collaborative ecosystem. So we work with various research organizations, be it MIT, Michigan, McGill. We work with a lot of new age medical device companies, startups, so to say, because we get requests for almost one device every week, and then we try to vet them up. We have actually helped 3 startups in US to get the FDA's approval in a period of like 2-3 years, because when they design something and then there are a lot of challenges with regards to the customer's fitment, with regards to the preferences and many other things. And we have actually helped them get those approvals as well. So yes, we are very, very open to partnering and collaborating, because the sector which we are in is huge. So if you are able to have your niche segment and then you partner and collaborate for different possibilities, I think it's good for the community, it's good for you as well.
Awesome. Thank you so much. So at 3:56, at 4, we have another track that is coming up, and we'll be joined by Bhadresh Kamar, who's angel investors. And so last 2 times he attended our session, he ended up investing in some startups. So all those of you are listening, take this opportunity. But I just want to do a couple of rounds. So give a 1 word or 2 word answers to it. So we'll start with Kumar. So if you were to describe your entrepreneurial journey into this health tech in 1 word, what would that word be? So all of you just share 1 word describing your entrepreneurial journey in 1 word. 1 or 2 words.
Roller coaster ride.
Okay, awesome. That is taken, so you cannot take that word. Romita.
Galaxy.
Pooja.
I would say Big Bang.
Sujay.
I would say it's the satisfaction which we get for what we do.
Yeah. Saurabh.
I'd say relentless.
Awesome. And what is your support system? That you have certain friends, you have certain mentor, or there is certain place you go and you get a peace of mind. Saurabh. This time we'll start with Saurabh.
You're saying what is
your support system? There are certain friends you have in life that really. Yeah. So anything that you can share.
My 2 dogs.
Awesome. The dogs are taken, so Sujay. You can have your dogs also there. Yes,
Music.
Pooja.
My son and my music both.
Okay, awesome. Romita.
Travel.
Kumar.
The Bangalore ecosystem.
Awesome. I wanted to ask a lot many questions, but one more and then we will move on to because Dr. Patel is going to share his experiences. But I forgot this question, but the question is about if everything happens the way you imagine it would be, in that case, what would your organization be? So Kumar.
it'll be the premier preventive healthcare organization.
Awesome. Because I asked this question because when you make that big, I can share this video that they spoke at my forum. Romita.
A decathlon for medical devices.
Awesome. Pooja.
The Pocket app for wellness management.
Awesome. Sujay.
Sorry, I didn't get understand that.
If everything happens the way you imagine it would be, in that case, what would iCure be?
We would be the voice of primary healthcare, so that no patient should die due to unavailability of the doctors.
Amazing. Thank you so much, Sujay. Saurabh.
Largest health insurance platform in the world.
Brilliant. Thank you so much, Kumar, Romita, Pooja, Sujay, and Saurabh for being part of this panel. We have Bhadresh Bhai, who has already arrived on stage. The way it happens in offline, then one panel gets over and another panel comes. So hi, Bhadresh Bhai, how are you?
Yeah, fine. Good afternoon, everybody.
Yes. So I was mentioning that you ended up investing in a couple of startups last time when you attended similar panels. So do you still have some money left to invest, or your investment is happening in your follow-on rounds?
Yeah, fine.
Okay, you'll end up investing in them. But thank you so much, Kumar, Romita, Pooja, Sujay, Saurabh. You can probably log out, or you can still remain and to be part of the conversation. So it's 4 p.m. So 4 to 4:15, we have a discussion about the technology business incubator, and then we'll have a brief discussion with Bhadresh Bhai, and at 4:30 we'll have some startups who'll be showcasing their startups. So thank you so much, everyone. Again, Dr. Patel, now the spotlight is on you. So if you can tell us a little more about the incubator, what are the things, what are the opportunities, and how people can get involved. Yes, Dr. Patel.
Yeah, thank you so much, Jatin, and entire panel for making it very fruitful and interactive one. So I'll not come in between Bhadresh Bhai and incubators who are waiting for that. So quickly take you through the IIPHG, TBI, who are we. So probably it will help you out, help all participants to understand that how exactly we can collaborate further. So this is what we are. So as rightly I already told about that, IIPG is a first of kind university. Same way it's a TBI, which is for a public health focusing. It's a first of kind technology business incubator in public health sector, which is actually focusing on non-communicable disease, communicable disease, predictive and diagnostic healthcare technologies, primary and community prevention on public health, and of course working on health technology related to AI, IT technology, machine learning, IoT-based healthcare devices, and so on and so forth in diagnosis and prognostic area. So that's why I provide the complete ecosystem support to the technology-based startup for public health, and all the ideas, innovations which are generated out of it, in-house or outside, which are nurtured and positioned for sustainable enterprise. That is what our motto is. And of course, this is a DST government-supported techno business incubator. Quickly, just to give you an idea that we have a mechanical as well as electronic fab lab with all kinds of machines. Machines are available where you can make a prototype. At the same time, we have a microbiology and molecular testing where human testings and other disease testings could be easily be done. And of course, the design lab, which is fully functional now with all team members, as well as the machines involved and instrumentation involved there. When it comes to services, so of course, apart from that, all Fab Lab and Micro Lab and all services, we have a mentoring pool, we have a co-working space, the way other are having, as well as IT supports and incubation support, all supports the way other have. Of course, we have one more unique thing is that we have in-house expertise of IPR. So the person who is handling is already having a patent as well as expert into that. And at the same time, Fab Lab, we have an expert who can design and develop many things now. So that's the beauty of this techno business incubator. But we felt that it's not only possible for a small team to maybe support entire as a part of entire ecosystem, but we thought that somewhere we need to have an expertise, and that's why for funding point of view, we have a collaboration with the BIRAC through Sign and also the IC through a nodal center Cradle. And that is how we are connected with the funding part, and we are going to have a few more avenues for a funding for incubators. Apart from that, we have a medical collaboration with the Jodhpur AIIMS, Datta Mega Institute of Varda, as well as biotechnology point of view of GSBTN. So we take support in terms of validation, in terms of many other things where inputs are required from biotech as well as medical part. And of course, from Ignite and GTU part, as well as LD College of Engineering, we have a technical support. Recently, we have a good collaboration with the CII. I am Ahmedabad. We have finance and project point of view. We are starting something soon, which will let you know. From pharmacy point of view, NIPER is just besides us, and of course for AIML, DICT Institute, which we have initial collaboration and understanding, and then we have IIT or KIT Kharagpur as well as KIT Bhubaneswar, a few collaboration in terms of understanding that how exactly we can support. So that is what 360 degrees ecosystem we have created, which will not only help idea to be generated, nurtured, or maybe in terms of commercialization. Just a glimpse, because first call was there in February 2020, and you know that in spite of COVID, we started our journey, which has actually delayed the entire process, but we are successful in getting 3 proposal, call for proposal, and incubated almost 20 incubators. If you are there, like toothbrushing teachers, the organic D powder, vitamin D, digital stethoscope, which are there. In COVID part, we took an opportunity to have one more call, and we incubated one, which is a very unique one, which was actually media coverage was there in Times of India as well as in HealthTech. So that is what the successful startup. Still in a prototyping and designing part and yet to be marketed, and we hope that and soon it will be marketed and useful for a COVID patient. That is what the infectious control assistant device, which is patent is already applied for that. We also do some in-house experimentation. So say for example, manhole savior, it's an in-house project we have started, thinking that to save the man who are going into the manhole. At the same time, when COVID was there, we are able to successfully manage some face shields as well as masks, just to test, not market, but whether we can do with the Fab Lab or not, an internal expert. At the same time, we have started pulse oximeter, because why? Because looking into the advantage, or maybe you can say that the environment, we got a lot of opportunity to interact with the good startup which are going to make oxygen concentrator as well as even ventilator, and that's why we thought that initially we start with at least pulse oximeter and go up to that level, whichever it is desired. And of course, apart from that, all technology part, we have online education portal with a chatbot facility, where the modules of COVID was as a part of e-learning. So we also do a lot of online learning and education part, and few workshop and webinar, which is commonly done in collaboration with various institute as well as many societies. Coming to one more important for student point of view or innovator point of view, we have an SSIP grant which is approved for that, and we have a financial support up to 2 lakhs for POC and product development, as well as IPR support for 25,000, and of course the non-financial, which I've talked about. Every facility is available, and all possible experts are available for mentoring, incubation, and facilities. Just to summarize about that, what we can do, I will do in last 1 hour. We have 5 incubation projects we have submitted on 17 18 calls of BIRAC with the help of Sign. They managed not only for just submission point of view, writing point of view, but the webinar, the awareness through webinar, as well as creating a support system. And not only that, they went beyond that and have a one-to-one mentor session with that. So that is what the collaboration we have at the Sign. So those who are potential one, probably get a good mileage, even though not directly funding from our side, but of course a funding from other schemes. And then once you know that you are eligible in a BIRAC one, that means you are good to go for any of the support system or any government or India government or state government. And that's why the 2 projects were selected in first round, and hopefully they will go through other 4 or 5 rounds, and probably they see the light at the end of the tunnel. And of course, with the local one, Nodal Institute, with the industry commissioner, we have applied for CREDL, and then the one project which has gone to 4 round, and now it is clear. So now grant would be disbursed to that project soon, and that's ICAD one. Of course, the last slide is about that, which kind of ideas you are looking for. So any idea, any innovative ideas, any incremental innovation. So not only just an innovation, but incremental innovation related to the public health, social work, preventive healthcare, epidemiology, public health, population health, community health, healthcare, technology. You are most welcome. You please reach us to us, and this is our team, a small team, including Drew, incubation manager, Poonam, junior epidemiologist, Yogesh Bhai, account and administrative HR, Ruchi from account, Arena from IT department, Ali from technology development, Fab Lab, and of course Daksh is also there from Fab Lab. Dr. Dilip Mavlunkar sir, who is our director overall under the umbrella of IIPHG, we are working. And of course, the PI of this project is Dr. Deepak Saxena, who is also professor of IIPHG. And of course, me as a CEO of NIDHI TBI, in charge of Techno Business Incubator. So yes, just stay connected and visit our website for further help or support, anything you require, we are there. I hope I have taken much time before Bhadresh Bhai comes into the picture. Thank you.
Thank you so much, sir. So we'll have a discussion with Bhadresh Bhai and then we'll get to the startup demos. So all the folks who are supposed to do startup demos, I've already got Gunjan and Chintan on stage. You can message me or you can let me know their names. I'll bring them on stage and we'll get started with the discussion with Bhadresh Bhai. So first of all, Bhadresh Bhai, officially, thank you so much for joining this session.
Thank you. Thank you for inviting.
So the theme of this talk is Fireside Chat with Startup Investors. So if you can tell us a little bit about your background, about your organization, and then I'll ask you a few more questions. Yes, Bhadresh Bhai.
Yeah, I'm pharma consulting in pharma industry, and I have done masters in pharmacy and masters in business. And I work for leading pharma companies for almost 13, 14 years globally. And I invested in some of the startup. And that is my hobby also to be a mentor in many startups. That's all about me. Yeah.
Awesome. And how did you get into startup investments? What was your first startup investment?
My first startup investment was IndiaBees. Then it was IndiaBees for sale, now IndiaBees. And that is actually, I went into one course in IIM Ahmedabad, merger acquisition. And then after that course, I somehow got to know regarding this CI activity. And then I found this startup, and then it was very, very interesting. I was actually following for 6 months, and then I finally invested in that startup.
Okay, awesome. I have a few questions for Dr. Patel also. Dr. Patel, you gave a fantastic presentation. So you must be getting a lot of startup applications. So how do you select? How do you know what are your priority areas that this kind of startup founders you would work more?
Yeah, so the first important thing is that the first criteria is that it should be focused on public health. So irrespective of whichever area, the focus should be on public health, specifically whatever area we have selected. We have a panel, internal panel, as well as we have an external panel from various institutes where we categorize into 5 more area where we found that yes, those are the area where focus should be there and marking systems would be there. And then round of entire session would be there one by one. So whosoever are selected probably get an opportunity to present for 10-15 minutes, and then followed by internal discussions and deliberation. We understand that what is the need, what support we can provide. So not only just a fantastic idea, but from our side, whether we can support or not, that criteria we keep in mind and ensure that the right incubators are there in our hand to see the light at the end of the tunnel.
Okay. And how do you, like you mentioned, but any one specific startup you can elaborate it on more that, that became part of the incubation. This is what you did. This is how they are scaling up, or this is where they are getting their idea converted into product or a business. Any one anecdote if you can share.
Okay, so what I understood that you wanted to understand one of the idea which has been
correct, and how they've been supported by the incubator.
So just give you an idea that iCAD is an infectious control device. So which is not only used for just aerosol infection prevention, but also it will be useful for any of the disease which is communicable. So that was the scale it can go. But it starts with that even COVID area, and then what you are doing is that you are creating a miniature negative pressure. You have seen that in hospital there is a big negative pressure system, which is costly one. But the idea was very simple and it's a very simple idea. If somebody told us, you create a normal miniature negative pressure which is around your head when you are doing intubation or something like that, a procedure which will absorb everything aerosols and prevent the infection. So that was a wonderful idea. Immediately we helped them out for an IT point of view. So our internal experts are there. We have connected with the IP team member, other team member who are associated with us. The first and foremost thing was done that. Simultaneously, manufacturing point of view and conceptual point of view, what kind of design can be developed. So it's a fluid mechanics designs and other designs where 2 people expert put together all the brain and ensure that so we have a 3 or 4 version out of that. So entire 4 version of prototype was developed. We faced a lot of problems in COVID, but still it was made. And the finally is that a clinical validation point of view. So we have a good connect with the entire hospital, and it was in 200 patients. It was actually used initially. So it's a bucket type of crude prototype to the fast last version is there. and very good response. So that is what stages. And then not only that, it was covered. So with the help of only TBI, it was covered in the Ashtak also, as well as in Times of India. So I just try to, and only the last part is that Barak, we have tried twice, and the third time we have now inside that. And apart from that, IC funding is also there. So entire team has presented well along with the promoters and ensure that they get into the race. So that is how entire scheme for one project, I can just say that, which may be possible for any other startup if they really go aggressively with that. So that is what.
And that offer of ice cream for a question remains. Arpan has won that. So friends, in case if you want to ask question, you can raise your hand or ask question in the chat. If you ask before during the session, that will enable me to bring you on stage. So that offer remains. Any question that you may want to ask Dr. Patel or Badresh Bhai, who is an investor, I'll continue asking them questions. One more question for Dr. Patel, and then I'll move to the Badresh Bhai. You mentioned about facilities that, how do you, so is it necessary that the founder has to be incubatee of the incubator to access facilities, or how do you go about it? Or if there are HealthTech founders associated, if they want to say it, any thoughts on that?
No. So first thing is that as a part of normal call process, people are screened and selected and incubated. But what we found is that even in other environment, looking into the current competition, that each and everybody who is walking, they are just incubated. So we have also tried to keep it open, but open doesn't mean that just anybody and everybody is coming there. But at the same time, we have created one system that the person should coming to our incubators either through Zoom call or maybe personally. Try to explain to the entire team that what they are going to do. It's an informal communications and understand. The moment we understand that there is a collaboration and synergy between us, we allow them as an associate or as a supported by, or even maybe if they are incubated somewhere else, we incubate as a co-incubators. So that is all three things are possible in our incubation center. So we are not restricted to only just call for proposal and selections.
Awesome. So friends, those of you who want to ask question, you can ask in chat or raise your hands. I'll bring you on stage. And but this way you mentioned that, brief about how you got into investment. So which are those one or two early startup investment that you may want to talk about, and how did you find them? How did you choose them to invest?
Yeah. Actually, one of your this eChai meeting only. I don't remember exactly what some event was. eChai event. I don't know the event name. So what happened? There were like 5 people presenting as a normal, agenda, and suddenly somebody came in, and then he requested you that can you give me 2 minutes to show my products, and then you allowed, and that was my investment. That in that company I invested. So that person just came in to you and requested you to present to the who were people there. So that was like, I remember that it was just like, it never happened like that. Yeah.
Awesome. But now that you have invested in multiple startups, is there a formula that you are following, or what is your criteria? Okay, they have to have a certain revenue, they have to be in a certain category.
With every new investment, the filters are increasing. Because every time you get new experience and then you have more filters. So the major thing is the idea. Idea should be the first thing, that it should be a real good idea, and then the background of the founder, and then skill set of the founder. These are the 3-4 things. So after that, then possibility of them scaling up, if they are capable, because sometimes the idea is good and background is good, but then scaling up, that managerial skill is not there in the founder. So sometimes manager skill is not there, and then if the founder is ready to bring in a manager, or he understands that he can't manage, that is okay. But sometimes founder think that he can manage and he can't scale up. So that is a problem. The founder should be open that he can manage the scale up. Scale up is a key. Many times, most of the people don't grow because of the thinking of the founder.
Yep. And you must have evaluated a lot of startups. So sometimes when you like the idea, you like the founder, but somehow you don't end up investing in them. Any anecdotes if you can share that? You wanted to invest, somehow you didn't go for it.
Yeah, because maybe with more investment in startup, so I do much more research, research in terms of, I'm not the expert in technology, I'm a pharma person. So I actually recently, one of the investment, we got a good, I was interested, and then I brought a specifically same industry guy to evaluate that together with me. And then later on, we didn't invest, but then we found out the person who was expert in that was my friend. So I told him that, can you evaluate on my behalf because I'm investing. So we did a lot of, brainstorming, and later on I didn't invest because he said that there are a lot of things which is like similar to others. So there was nothing new. So I bring the help of the experts network. Yeah.
Okay, awesome. So now, what's the way forward for you? Are you looking for more startup investments, or you say yes because there are people who are supposed to present?
Yeah, always. If it is extraordinary thing, always like I'm open. If I'm not open, I will always spread to my network who are always open. So I'm always looking for a good thing, which is like I feel that okay, let's get into this, even if together, alone or together with my friends or like that. It is always open, and there is no industry specific. It's just an idea.
And what's your process? That you individually invest, or you make a group of angels?
If the investment is larger, then I try to get 3-4 people getting into one. If it is a very early stage and a very small startup, then I can do myself. I do myself alone. I try to do early stage because later stage, maybe, I don't know, many people are already there.
Okay, friends, those of you who have any questions, you can raise your hand. I'll bring you on stage to ask question. Gunjan, Chintan, you are supposed to present, and I believe you are presenting because you are seeking some support. we have folks who are giving that support. So any question you may want to ask them. Gunjan, Chintan. Okay, anybody else who would want to take up this opportunity to ask question? So another thing I would really encourage all of you, if you're getting into startups or entrepreneurship, ask questions. If you get that, because if you see my profile, I only ask questions because I never become speakers. I always become moderator, and that creates a great momentum for you, whatever you would want to do. Anybody else would want to ask? Arpan had raised hand, I believe. Arpan, you want to ask a question to Bhadresh Bhai or Dr. Patel?
I think question is to you, Jatin.
Yes, please.
I also want to present our startup. Do we have time slot available?
So if you have time, definitely we will allow you to speak up. And Reena is the Karta Dharta of this startup presentation. So just text Reena. But if you have time, we will give this opportunity to you. Since you also won that ice cream. Anybody else would want to ask question? Gunjan, Chintan, Rajesh? Else I'll continue with asking a question that but friends, if you're watching this, I believe a lot of you invested 1 hour of your time watching this conversation, being part of Zoom or social media. You must have some sort of a queries. There are no judgments, and nobody will judge you whether the kind of question that you ask, but ask question because that will help us to enable the kind of programming that we could deliver for you. Else I'll continue with, yes.
Yeah, Gunjan here, yeah. I can ask. So recently I watched a TV series based on startups and entrepreneurs. There I checked there was a startup founder who got 2 offers. One was a really huge offer based on a really huge valuation, and other was on a reasonable valuation. So a person suggested to go for a lower valuation because if you take the higher valuation, the expectations would also be high, and you would be flying too close to the sun. So how does valuing your company, or how to calculate a valuation of your startup if you're looking for investments?
Yep. And Bhadresh, if you can share from investors' perspective, a lot of startups you invested, they ended up raising next round. So in that case, yes.
I would say otherwise. If the founder doesn't have confidence to have a bigger valuation, then maybe it's a problem because founders should have $1 billion valuation always. Like when you think about it, when you think that okay, this is an idea, and then if it is $1 billion idea only you get into, or some large idea, So if founder should have a confidence that okay, this is a valuation, and then he should be able to do. Never have a less faith on your own idea. Otherwise the outside people will think that okay, you are not confident to manage. That's what my thinking.
Yep. And sometimes, Gunjan, a lot of this becomes very contextual. So it is always better to understand, what the investors that you're talking to, how they approach, what is the experience from the founders that they already invested in, and what is the experience of the founders in your industry. And thanks to various communities, incubators, you'll always find those people and who've been through that process. So it would be good way to start with to get to the conclusion of what you would want to do. Anybody else?
If you get an expert who is doing lower valuation, it's good. Like an expert who can really add big value. So that is a different scenario. If somebody is a very good person and then you get a lower valuation, it's a wonderful thing because you get a bigger value later on.
But as a thumb rule, never sell yourself short.
Yeah, that's right.
Unless until some big shot, the person you really want to invest in you, never sell yourself short. There are a couple of more questions that I would wanted to ask, but anyone else who would want to ask a question, you can ask away. So Bhadresh bhai, you must have seen a lot of startups. So if you were to give top 3 recommendations to early stage startup founders on what are the things they should really take care that would increase chances of they raising funds from HNIs or angel investors.
Yeah, I can tell you one thing that see, initially what I believe is that if possible, there is a chance of revenue generation, little bit small revenue generation that gives a confidence to the investor, smallest revenue generation, or even if there is no revenue generation, if you show a good path of revenue generation, that this is the first way of revenue generation. Because many times those forecasting and proposal, I get received, it is just Excel sheet, exploration, nothing, concrete, some mind is not there getting into how actually stepwise, percentage-wise growth and like that, nothing. So that is the first thing. Second thing, I would say that the initial few people in the startup is very, very important. They can actually, doom you badly if the initial people who are around you. So they should be really, committed with your startup. That is the first thing. And the third thing, I would say that when you take an investment, so that investment should really come from somebody who can strategically help you, because otherwise initial investment, the small investment may, if it's just a money lending, it might not work actually initially. These are the 3-4 things I can tell you.
Okay. Dr. Patel, you want to ask a question to Bhadresh bhai? From an incubator's perspective?
Okay, so maybe Bhadresh bhai, because we have connected earlier, unfortunately.
Yes. Yeah, I couldn't actually come there. Sorry.
So we'll connect again for this. Yeah. So Bhadresh bhai, just wanted to know a little bit more, because from incubator's point of view and audience point of view, Chintan has rightly asked that valuation point of view. So one is that, say for example, 5 lakhs or 5 crore, and another is 10 crore or 10 lakh. And you say that is strategically it is more important from founder point of view. But when you are looking from an incubator's point of view, they are very at early stage, and the chances of success would be maybe remote in the sense we scrutinize and screen in such a way that chances are there, but we don't know what kind of success is there compared to the highly funded or highly supported by good and huge ecosystem and startup being in a small one. So just this question very shortly I'm asking. The question is that what kind of startup you would be looking where you would like to invest as a pharma guy or as a healthcare technology guy?
If you see the healthcare technology, suppose the one part is a variable, or you can say the devices part, or like whatever real-time lab data which is coming, lab data or real-time any health-related data coming in the variable. That is one area which will be future, whichever way it comes. How it comes as a product, I don't know, but some product will come that you can instantly, a diabetic patient can instantly know that okay, sugar is down, you take the whatever whatever real-time things happen in any disease, any real-time lab. So that any disease, if there is a real-time data coming in and helping the patient, that will be one of the area. And other area you see that in the area of drug discovery, this quantum computing is coming in. So like normal competing say, I think 10,000, I don't know kitna times zyada hai. So that competing, if you use in this discovery side and somebody is using properly, so that can also help, discover the drug faster. And the third is the clinical side. Clinical side, if somebody has a very good, programming and data, which can actually, make a real-time data and fast processing as per the USFDA or other, guidelines of the European guidelines, or so then that will be the area which, if you see the healthcare side, I'm just looking.
Oh, wonderful. So now I think Bakul, Dr. Bakul, Dr. Rajesh Mehta and Purnabai, Gunjan, and even one more Chintan is actually a right place for them to get a funding over a period of time, not only from you, but maybe from other, because they are into that sector only.
Yeah.
So
okay.
Once you get from that, probably you can help with us in terms of not only through and through, or maybe directly also if
Sure.
it sounds to you, and that will be helpful. Yeah.
Yeah.
Thank you so much. So we'll do a startup demos. So Chintan, Bakul, Dr. Rajesh, Gunjan. So we, if you observed, we started exactly at 3. Panel got over exactly at 4, and this panel, this fireside chat with Bhadrashbhai is finishing at 4:30. So we will follow time to the precise. Each startup gets 5 minutes as a whole. So try to finish your presentation in 4, so that 1 minute is still left for a question. Sometimes what I've observed when people present, they show one slide and 5 minutes are over, and they talk about only challenge. Don't do that. Talk about what you have built. Try to do that and utilize those 4 minutes really well, so that 1 minute we can get to the question. We'll start with Chintan first. Chintan, utilize this opportunity and speak with some energy.
Okay.
I believe Reena will be bringing the presentations.
Can you give me just 1 minute? I open the presentation. Hello.
Yes.
Sorry, but
yeah, Chintan, we have already shared your presentation. You can start.
Okay. Thank you. Hello, sir. So basically, my startup is the digital stethoscope. Right now, we know that the stethoscope is the basic device for the diagnosis purpose. And continually means right now, the mostly people are using the acoustic type stethoscope, and it has a certain limits because in the acoustic type stethoscope, there are the volume of this stethoscope is very low, so it's hardly analyzed to the disease or heart disease or the pulmonary disease. So we are right now working on the digital stethoscope. So the main benefit of this stethoscope is you can amplify the sound up to 20x, and the other function we actually added like the Bluetooth and also the AI function. So you can actually share the audio sound with another doctors, as well as you can record. And the more thing is the AI process. So it's means in the we are working on that, but maybe the AI is very helpful to diagnose the disease. So this is a main function we added in the digital stethoscope, and right now we actually we trial on the different type of the patient, and we receive the hello, sorry.
Yes, we are listening.
Yeah. So the sound quality is comparatively better compared to the acoustic stethoscope. So that kind of the function actually we added in this device. So, and as well as you can use as a home care, as well as the doctor can easily use this kind of the stethoscope. You can see the pictures. Can you hello?
Yes,
Can
we
you?
are listening and we are seeing what
This is actually our digital stethoscope, and right now the many companies are working on that, and they sell that kind of the digital stethoscope like the Litman. This is actually the boss of the stethoscope, as well as the Think Labs, but the price was the stethoscope is very high. Means talking about the Litman, the price is starting from the is 40,000, and the Things Lab is also is aroundly $500. So the price of this kind of the device is very costly. So we are working on the all things, and we implant the all kind of the feature which help to diagnosis very well. So this is our concept.
Awesome. So you're done, right?
Yes. Thank you.
You finished in almost 3.5 minutes. Thank you so much. You can stop screen share from your side. But this is why you want to ask any one question.
So is it the price is advantage? What is the advantage? Price because there are a lot of electronic stethoscope available on Alibaba, if you see, and even digital stethoscope, there are plenty of supplier. So is the price advantage?
No, actually I have many stethoscope. Means for the reference I purchased the 7 stethoscope, means the different company, evenly Litman se leke means Alibaba ke local. But the problem is that the sound quality is not a better because of the when you're talking about the electronic side, from the doctor side, the sound is not a proper. Means in the acoustic type you can hear the clear sound, is the natural sound, but in the electronic stethoscope there are some you can see there's some artificial sounds, means basically because of the there's not a natural, means this is actually the processing sound. So there is the limit, and this is a big thing for the doctors.
What is the cost?
Right now we are not decided the cost, but we are launching in between the 15 to 20,000.
See, Chintan, one thing, just I don't know whether it is correct or not.
Okay.
Mostly stethoscopes are used by GP, what I understand. And when you go to the specialist like gastro or some onco or some other specialist, derma or specialist, they don't use stethoscope. So
But that's right. And Chintan, we want to move on to the next startup, but we can take this discussion offline. Chintan, I wanted to ask you one more thing. Dr. Kamlesh Patel mentioned about what kind of help incubators get, but what kind of support you get from the technology business incubator?
Sorry.
What kind of support you got from NIDHI TBI?
Actually, they're supporting the pattern as well as they have a good lab facility. I means मैंने यहाँ से 3D printing casing और सब कुछ वहीं से करवाया है, और basically they are supporting from the doctor side also. So
तो जो लोग NIDHI TBI से supported है उनको associate उनको आप discount दोगे अपने product में?
Of course, sir, of course.
Okay, thank you so much, Chintan, and probably we can take this discussion with Bhadraj bhai separately. Thank you so much, Chintan. Now we'll move to Dr. Rajesh. I believe Reena or Dhruv will be sharing the screen. Dr. Rajesh, you need not share your screen. They'll share your presentation. Dr. Rajesh. You can open up your video also. Yes, please. Your time starts now.
Hello.
Yes, we can hear you. Dr. Rajesh, your voice is breaking. We cannot hear you.
On behalf of Purna Mehta, I'm audible?
Yeah, now clear.
About detection of vitamin. So it is of disease. Okay. So basically is very important to prevent hundreds of disease, including COVID-19 and cough and cold, diarrhea, etc., etc. So now, but detection is very difficult because laboratories will charge 4,000 rupees for a single test, while this instrument will be able to detect thousands of people without any money. It just uses a small electric current, nothing else. Next, please. Next slide. Can I have next slide, please?
Veena or Dhruv, can you get it?
So this slide shows the importance that it can prevent many diseases like skin disease, etc. And in addition to the low cost, if the other addition is that if you support this kind of innovation, we have a list of 50 more such innovations. If we are successful in this, So that is the advantage. And the most important is even fifth standard pass person can test with this instrument. And the treatment is very simple. Vitamin A tablet costing less than 75 paisa that can cure the vitamin A deficiency. Next, please. So, but the instrument cost we have kept 1.5 lakh rupees because we are working on it for more than last 20 years. Next, please. Can I have next slide? The team includes myself and my son Purna Mehta and few mechanical engineers and electronic engineers. Together we are doing it. It is almost on the verge of completion. We have already few prototypes, but it requires mechanical handling. Now we are completing, converting into a automatic transmission or automatic settings. That's why it will take. Please. So we have already applied for 7 countries for patent. And we propose that whosoever bears the charges of patent in a particular country, we will give a 50% of the profit for that country. For example, in Nigeria, if somebody gives us money for the patent, which will be around 1.5 to 2 lakh, then 50% of the profit of sale of that instrument will go to that person. And ultimately, we would cover more and more countries. Next, please. So we suggest that there should be common platform for the application of the patent in various countries because we already spend more than 12 lakh rupees for the patent. So if you have a common platform, the advocate fee will be reduced. And there should be, government is giving a subsidy, but we don't know how to apply for the subsidy. So that, and then there should be a need assessment mechanism. This is the idea. But how many people need this? If we devise this need assessment mechanism, it will be very helpful. And what we need, the workshop having all the necessary equipment from starting from electricity or carpentry, etc., etc. So I only appeal that if you support this single idea, then probably we have lots of things to go. My presentation is over.
Awesome. Thank you so much, sir. Badresh sir, you want to ask any one question?
Yes, Rajesh bhai, who will use this instrument?
Basically, this instrument will be used by RTO, ophthalmologists, laboratory people, and even ASHA worker in the village. Because in 1,000 village, at least you will be able to find out 20 to 30 person. That means 2 to 3% you will find out vitamin A deficiency. But right now, even doctors themselves do not know whether they are suffering from vitamin deficiency or not, whether it's a surgeon or postgraduate doctors, because they never have undergone a vitamin A level in their blood. You know about B12, you know about vitamin D, but vitamin A is very difficult.
But actually, what I understand is a very, very low number of vitamin, 100,000, less than 100,000 or 100,000 a year out of this 120 crore population. Isn't it too small market? And then when the
2 to 3% are having vitamin A deficiency. 2 to 3% of the population having vitamin deficiency. So if you see the subclinical level, then you will be able to detect lot many people. If you, because we don't have an assessment right now, because laboratory charge is too much, and the retinol is so labile that it is very difficult to detect. While in this instrument, you don't require a blood to take, and which is a non-invasive technique.
Okay, thank you so much. We'll move on to the next person now. Thank you so much, Dr. Rajesh Mehta. And if you want to connect with Badresh, you can reach out to him. Now we'll get to the yes, Gunjan, you can show your face to us. Yes, Gunjan.
Yeah, hi everyone.
Yes, your time starts now, Gunjan.
So hello everyone. My startup with Dr. Dinesh Rathod is about non-invasive technology for hemoglobin estimation. About us. So since this is a medtech startup, so both of us share the med and tech equally. Dr. Dinesh Rathod is a pathologist, anti-pathologist, and he has over 18 plus years of experience. I myself have completed postgraduate diploma in machine learning and AI, so I bring the tech part into this startup. Of problem statement. So hemoglobin estimation. So as you know, hemoglobin can tell you the iron deficiency in a person. And during a recent study conducted, it was found that more than 52% of non-pregnant women of reproductive age suffered from anemia in India. So the need of detecting this disease early on and preventing it is actually the need of the hour. Currently, how hemoglobin is estimated. So currently, you can test your hemoglobin by taking blood from the capillary, which is an invasive method. This method requires a lot of manpower, trained manpower, lab technicians, and also requires a lot of consumables. So doing this test on a large scale in a nation like India is a logistical nightmare. So what we do, our idea is using a non-invasive methodology using optometry to calculate the hemoglobin. So if we can even create a filter where we get the output of hemoglobin from in our device. Below the output, the people would be anemic, and above they would be safe. So we can then only use the blood test and the consumables and the resources that we have to put it in the special people, and we can really speed up the entire process. So we use that. So currently, as you may all have seen and use the pulse oximeter. So our idea in the long term is to create a similar kind of device. Instead of giving out the SpO2, what we want to calculate is SpHb, that is the hemoglobin. Yes. So progress. Do you have an image in the next slide? Yeah, so this is like a broad basic prototype that we created. The finger that you see behold the sensors, those were used, and we have a microcontroller using which we got the hemoglobin, but this is not yet calibrated. Due to the ongoing pandemic, we haven't been able to calibrate the device since we would need to conduct a lot of blood tests. We would need to get a lot of hemoglobin data. But because currently the resources are limited and are completely used for the pandemic, so we haven't been able to generate those data and calibrate our devices. But in the near future, we surely want to do so. Next. So in the near future, we want to come up with a commercially viable project. Now, as you know, like the number that I told you, 52%. So there is the big market for the device. And if we could, in some way, with the help of IIPS, collaborate with governments, state governments, national governments, and create drives, create multiple products. And this doesn't require a trained professional. Anyone with basic knowledge could perform this study and scan. So we would be able to do this on a large scale, get medical body approvals from ICMR, BCCI if required. We would want to do that. We would then want to conduct trials and calibration to understand what is our efficacy of products, and then improve on it if required, and get it calibrated to the Indian population. Thank you.
Awesome. Thank you so much, Gunjan. So Badra sir, probably we can finish all the presentation and then you can give your input on the things that they should take care of. Thank you so much, Gunjan. Now we'll move to the Bakul. Bakul, you are one of the, we are towards the last part of the session. So you have to show some great energy. Yes, Bakul. You'll have to unmute and speak up.
Yeah, so our team are making the camera-based 3D digitization system for the brain imaging application. Can you, next slide? Yeah, so basically when we look at the neuroimaging, so particularly electroencephalogram and the MEG and the TDCS, so all are the electrical signals. So EEG and MEG, we are actually recording the brain signal, and TDCS is actually stimulating the brain through electrical current. So, but to identify at particular location, where is the source of the electrical activity, or where is we want to apply the electrical current. So that anatomical or geometry information is from the MRI. So to bring into one coordinate system that electrical signal and this anatomy, we need digitization of the head, this entire skull surface, one nose, and beside the ears, and also the electrodes, all electrodes on the EEG cap, or MEG on sensor on the MEG, or TDCS position. So it's basically the correlation between the electrode and the MRI. So next slide. Yeah. Next slide, please. Yeah. Yes, this one. So basically, current solution in the market is one is the electromagnetic based device, which is widely used, but the cost is more than $8,000, and it is quite interfere with electrical or some electromagnetic noise. Another is the camera-based device, that is a Polaris system. Here you can see. Again, this is a stereo camera-based, but price is quite high, $10,000. And the third one is the we can scan the entire face through the camera. Its price is low, but we cannot digitize the skull surface below the hair because it's a camera, so we can't visualize the skull. Can you next? Next slide. Yeah. So what is our focus will be? So all our devices are general purpose device. It is not tuned with the particular application of this neuroimaging application. So our team are more focused on the neuroimaging application, which increase the functionality. So yes, different device have different issues. That is a line of sight issue for the vision based. Sometimes we need the touch sensitivity of that probe, which is not present in previous devices. Wireless, more compatible solution for it. So current setup is going almost. This setup is reached up to 30 to 40 lakh in current scenario. So that's why this application, particularly in India, epilepsy, like we want to source look as the epileptic patient to identify the source of the epilepsy. So generally we do not found that kind of source look and lab in India because of the cost constraint. So yes, our focus will be low cost but higher functionality of our entire system. Yeah, so our current status is more on the prototype development. Right now we are just developing one probe is already developed, but we still need to modify it. And the low cost we are planning is in manufacturing cost. Then other cost is fine, but we are planning manufacturing cost should be less than $500. That is.
Awesome.
Yeah. So yeah. So it is of course. Yeah. So there are many market players in this field, but and they actually make a copy. It is possible. But I think they can't they find difficulty to compete with the pricing. So considering the labor and environment here. Right. Yeah. So yeah, one I want to discuss. Actually, I have a question when you ask me. So yes, of course, this have a actually niche market. It is not a general purpose market. So it is specific lab or specific institute only require this device. So more even in terms of rather than device is more about maintenance and parts selling. Yes, but it's extendable to other healthcare modality as well. Where is the 3D information we need? Neurosurgery, orthopedic surgery.
Bakul, your 5 minutes are almost over.
Yeah.
Okay. Thank you. Thank you so much. So friends, so one of the idea that you are presenting, the idea is that you present here, it becomes a good practice for you, because as you scale up your venture, you'll end up pitching to a lot of government agencies, investors, or enterprises. So you can treat this as a good practice, so that whether you are able to communicate your idea. So sometimes one common thing you'll always observe is that when you present, and all the people who watch your presentation, they ask you the same question, and you must have felt that. So that you should take that as a feedback, that if people are asking me the same set of questions every time, why don't I answer those questions in my presentation itself? sometimes, what people become very smart, all people ask me the same questions. Then it is not their problem. It is your problem if people ask you the same questions for your presentation. So you can treat this as a practice. And now that Bhadresh Bhai had mentioned one incident where last time somebody presented out of 10. So we have Arpan with us. Arpan, 2 minutes, because 4:53, we want to finish at 4:55, and then we have some closing remarks from Bhadresh Bhai. What would be his recommendations? Arpan, in 2 minutes, if you can finish your startup presentation. Yes, Arpan. You can unmute and speak up.
Hello. Yeah. So can you see my screen?
Yes, yes.
Yeah. So we are Growthbook. We are a small team. We have a pediatric doctor on our board, and who actually created this solution. And he has background in community health. My background is in technology company scaling, and other founder is a CTO. Our vision is to make child healthcare accessible and affordable, and also bias free, because we see a lot of companies has a challenge that because they get into private labels, they get into e-commerce play, they have a bias towards what advice they provide. So that's what we want to do. Why this problem, like the child to pediatrician ratio is extremely low. Still, like even if you are talking about rural areas, there is accessibility of pediatrics. Pediatric experts are extremely low. Affordability is also a huge issue, and awareness is also a huge issue. Like statistically, if we are fixing all this issue, we are looking at increasing productivity and GDP, and also we are breaking a chain of economical outcome, because you have a nutrition issue, then you have a mental development issue, and again it's a economical outcome.
Arpan, I'm sorry, last 30 minutes, so you can get to the closure.
Yeah, sure. So our target audience is mothers and young parents. We have key players. Everyone know First Cry, and those players are already there. First Cry, Milo Parenting, Baby Chakra is household names. How we want to do it different is there are 3 things we want to do. We want to make it accessible. So number one, we are creating an offering for doctors. We are creating offerings for public health offices, and I think
you can Arpan, you can get to the last time when we have a pre-finalized demo with you. We could show a presentation in that.
Sure. I think the last 10 30 seconds, Jatin. So
no, Arpan, I'm really sorry. Anyways, it's
okay.
It's just that we wanted to, in a good faith, give you the opportunity. You can be, but
sure. No worries.
Anyway, what
I think
looking for investments or right partners.
Yeah, we are looking for investment.
Arpan.
Yeah. All right.
Awesome. Thank you so much, Arpan. Probably, Reena, you can connect with Arpan, and probably we can discuss further, how we can take it further. But Growthbook seems a very interesting product, and all the best for that. I'm really sorry, but
thank you.
We want to finish on time.
No, Jatin, you don't need to be. Okay. Thank you.
Thank you so much.
Arpan, you connect separately for this one. So
sure, Dr. Patel. Sure.
Yeah.
Yep. So we are towards the end. Bhadresh Bhai, any last remarks based on the presentation that, what would be your feedback to them?
My 2-3 remarks. Like first is like Bakul gave a presentation. So not specifically Bakul, but many times when the presentation happens, actually in the first 2 sentences, you should be clear. Actually, the problem and solution, first 2 sentences, not more than two sentences. The problem and the solution. So in Bakul's case, I couldn't actually understand what is the problem. And one of the suggestions to Bakul is investors are not pharmacologists. So you need to make it a layman language, very, very, simple language. The problem I understand is for brain concentration, improve the brain concentration and brain efficiency. But then make it in a very, easy way for understanding.
Definitely, sure.
Yeah. And the last thing I want to tell you that is you go to Amazon, Alibaba, many other platforms to see before you get into any product. So it should be better than that. That's the idea. Okay.
Awesome. Thank you so much, everyone. You can connect with all our speakers and panelists on LinkedIn, on Twitter. You can reach out to them. You can be part of the IIPHG Technology Business Incubator ecosystem also. Dr. Patel, we are 4-5 yet, so you have 2 minutes. Reena, closing remarks from your side for this session. Yep. Dr. Patel.
Yeah, Jatin, extremely important session, and really you made it very interactive. Lot of questions were asked, and it was addressed aptly from everybody's point of view, speaker's point of view. Also, all kind of angles we were able to connect and incorporate into entire presentation. So it was wonderful experience for me also being a part of that, and thank you so much for making this successful, Bhadresh bhai. Thank you so much for coming and giving enlightening and all incubators who can really would like to success in their entire project and startup. And of course, thank you so much for all audience who has really participated and very actively, proactively, and those who have presented, all incubators, Rajesh bhai, Gunjan, even Chintan, Bakul, and Arpan also. So I'm really happy to see the progress, and then probably over a period of time we'll have more kind of this kind of initiatives which will help you to success to be successful in your endeavor. And of course, last but not the least is that all audience who've been a part of since 3 o'clock, and so that's thank you to all for kind patience and listening. And of course, my entire team IIPHG, including Professor Maulankar sir, Director, Dr. Deepak, Dhruv, Reena, Ali, Dr. Poonam, Ruchi, Yogesh bhai, and even Daksh, all have really put a lot of efforts and making it successful. So thank you so much to everyone, and look forward for further interaction and further process which will have in a collaborative way, having a mutual understanding and benefit to each one of us.
Awesome. Almost 5 p.m. We started on time, finishing on time. Arpan funding लेने आया था, लेकिन उसको आइसक्रीम अभी
वो कैसे मिलता है जतिन आइसक्रीम पता नहीं है.
फंडिंग भी कभी देंगे हम लोग. But thank you so much, everyone, and you can visit IIPHG TBI website, eChai website, and hopefully when things get better, we could do a meetup in person.